Most heart attacks do not come out of nowhere. They build up slowly, and the body almost always gives early warnings. The problem is, they are easy to miss. They feel mild, ordinary, safe. But ignoring them can lead to something far worse. And once it happens, you cannot go back. In this video, I will show you 8 subtle symptoms that may appear weeks before a heart attack. Many people overlook them. Some do not survive long enough to wish they had paid attention. Stay with me. This might be the most important video you watch this year. So let's begin with one of the most common early warning signs. It often feels harmless at first, but your body may be more exhausted than you think. 1. Fatigue that doesn't go away. Fatigue is something most people expect with age, but when it lingers for weeks or even months and does not improve with rest, it is no longer something you should ignore. This kind of persistent tiredness can be an early sign that your heart is struggling. When the heart cannot pump blood as effectively as it should, less oxygen reaches your muscles and brain. Your body has to work harder to do normal things, and that creates a kind of exhaustion that sleep cannot fix. People often describe it as a heavy, drained feeling. You might notice that walking short distances, doing light chores, or even getting dressed takes more effort than before. This symptom can build up slowly. You might start napping more often. You might skip activities you used to enjoy, and it is easy to mistake it for aging or just poor sleep. But if you feel tired doing things that never used to slow you down, your heart might be to blame. The first step is to pay attention. Keep track of when the fatigue happens and how it affects your day. Make sure you are getting enough hydration, nutrition, and sleep. But most importantly, talk to your doctor. A simple checkup can uncover early heart issues before they become serious. Your body does not get tired for no reason. Sometimes fatigue is the only way your heart can call for help. But fatigue is not the only quiet signal your heart may send. Let's talk about something even more noticeable: your breathing. Number 2, shortness of breath with everyday tasks. If you are getting short of breath doing simple things like walking to the bathroom, climbing a few stairs, or getting dressed, you should not brush it off. This kind of breathlessness, especially if it is new or worsening, may be an early sign that your heart is not working as it should. Your heart and lungs work together to supply oxygen to your body. When the heart becomes weaker or blood flow is restricted, your lungs may not get the oxygen they need to pass along. This can leave you feeling winded from light activity. You might also notice tightness in your chest or feel like you need to pause often to catch your breath. Many people think this is just part of aging or being out of shape. But when it comes on suddenly or worsens over time, it may be a sign of heart failure or blocked arteries. Sometimes the shortness of breath is worse when lying down flat or during the night. That can point to fluid buildup in the lungs, which is also related to the heart. What can you do? Keep an eye on how often it happens and what activities bring it on. Try to stay physically active within your limits and sleep with your head slightly elevated if it helps. But do not ignore this. Schedule a visit with your doctor and describe the pattern clearly. Early intervention can prevent bigger problems later. If your breath feels off during the day, what happens at night can be even more telling. 3. Sleep disturbances or waking up, gasping. Waking up in the middle of the night, gasping for air, or feeling like you cannot breathe deeply is not just a bad dream. It could be a warning sign that your heart is under pressure. Many people who later develop heart problems report changes in their sleep weeks or months beforehand. The heart is responsible for circulating oxygen throughout the body. When it begins to struggle, fluid can back up in the lungs, especially when lying flat. This can cause nighttime shortness of breath, coughing in bed, or the need to use multiple pillows to sleep comfortably. Some people wake up suddenly, feeling panicked or breathless, without knowing why. If you notice these patterns, take a few steps. Avoid eating or drinking alcohol close to bedtime, as that can worsen symptoms. Try sleeping with your upper body slightly elevated. Most importantly, talk to your doctor. Describe exactly what happens at night. Sleep disturbances related to the heart are more common than people think, and catching them early could prevent serious complications later. Now, let's look at a symptom that often comes and goes but should never be ignored. 4. Chest pressure that comes and goes. Chest pain is the symptom most people associate with heart attacks. But not all heart-related discomfort feels sharp or intense. In fact, one of the most common early warning signs is a type of chest pressure that comes and goes. It may feel like a heaviness, tightness, or squeezing in the center of the chest. Some describe it as if someone were sitting on their chest. This pressure often happens during physical activity or emotional stress. It may fade when you sit down or rest. That pattern is a major clue. It tells us that the heart muscle might not be getting enough oxygen during times of demand. The medical term for this is angina. It is not yet a heart attack, but it signals that blood flow to the heart is restricted. Angina can occur weeks or even months before a heart attack. Many people ignore it because the discomfort is mild, brief, or disappears quickly. But if you feel pressure or tightness that shows up with exertion and eases with rest, do not wait. Keep a diary of when it happens and what you were doing at the time. Avoid pushing yourself through the pain. Limit physical strain until you see a doctor. You may need a stress test or imaging to evaluate blood flow to the heart. Identifying restricted blood supply early could be the key to preventing a life-threatening event. Always take chest discomfort seriously, even if it does not feel dramatic. Not all heart warnings show up in the chest. Some appear in places you might never expect. 5. Pain in jaw, neck, or upper back. When we think of heart problems, we think of pain in the chest. But for many people, especially women, the signs are much more subtle. One overlooked symptom is discomfort in the jaw, neck, or upper back. This pain may come and go. It may feel dull, tight, or achy, and it often does not feel strong enough to cause alarm. So, why does it happen? The nerves that carry pain signals from the heart sometimes send those signals to other parts of the body. This is called referred pain. The upper back, shoulders, and jaw all share nerve pathways with the heart. That means when the heart is under strain, you might feel it elsewhere. This type of discomfort often shows up during moments of physical activity or emotional stress. It fades with rest, which can make it easy to ignore or mislabel as muscle strain or tension. But if the pain keeps returning, especially in combination with fatigue or shortness of breath, it is time to pay attention. Do not try to self-diagnose. Keep track of when and where the pain happens. Try not to treat it with only pain relievers or massages if it continues without clear cause. Bring it up with your doctor and be specific about the location and timing. This type of pain can be an early sign of heart trouble and should never be dismissed as just stiffness or posture. Another signal that often gets dismissed is cold sweat without any clear reason. 6. Cold sweats without reason. Most of us associate sweating with physical exertion or hot weather, but if you start to experience cold sweats without any clear reason, especially when you are at rest, your body might be reacting to something more serious. This can be one of the earliest warning signs of heart distress. When the heart is struggling, the nervous system may respond by triggering a stress reaction. That includes rapid breathing, increased heart rate, and cold sweating. This is your body going into alert mode, trying to maintain balance under internal pressure. You might feel clammy, dizzy, or weak at the same time. Some people describe it as feeling faint or out of breath even while sitting still. Cold sweats are often overlooked because they pass quickly or seem harmless. But when they occur alongside fatigue, chest discomfort, or nausea, they could signal that the heart is under strain. This is especially true if it happens more than once or is paired with other subtle changes in how your body feels. If you experience this, stop what you are doing and rest. Make a mental note or write down when it happened and what you felt. Do not assume it is stress or dehydration without checking with a doctor. Cold sweats may be one of the last quiet warnings before a serious cardiac event. Listening to your body at this stage can prevent something far worse. But sometimes the heart disguises its signals as something much more common, like indigestion. 7. Heartburn or indigestion that keeps coming back. Heartburn is often blamed on spicy food, late-night eating, or a sensitive stomach. But not all burning chest sensations are caused by digestion. In some cases, persistent heartburn or indigestion can be an early sign of heart trouble, especially in older adults. The lower chest and upper abdomen are areas where heart and stomach symptoms can feel very similar. When the heart lacks oxygen, it can produce a sensation that mimics acid reflux. You might feel pressure, burning, or tightness in the chest after eating or when lying down. It may come and go or feel like a dull ache behind the breastbone. Many people take antacids or over-the-counter medications for weeks without improvement. If the discomfort keeps coming back or feels different from your usual digestive symptoms, it is important to consider a heart-related cause. This is especially true if it occurs along with shortness of breath, fatigue, or nausea. If you notice that your usual remedies are not helping, make an appointment to get checked. Do not assume it is just your stomach. A doctor can run simple tests to rule out any heart involvement. The earlier this is caught, the better your chances of avoiding a more serious event. When in doubt, always rule out the heart first. And finally, pay close attention to the rhythm of your heart. When it feels off, it often means something deeper is going on. 8. Irregular heartbeat or fluttering. Every now and then, most people feel their heart skip a beat or race for a moment. But if you start feeling your heart flutter, pound, or beat unevenly more often, it could be a sign that something deeper is happening. An irregular heartbeat, also known as an arrhythmia, can occur when the electrical system that controls the heart becomes unstable. This can reduce how well the heart pumps blood, which may lead to dizziness, fatigue, or even fainting. You might notice this fluttering when you are resting, lying down, or after light exertion. Some people describe it as a flip-flop sensation in the chest. Arrhythmias are not always dangerous, but when they become frequent, they can increase your risk of stroke or heart failure. This is especially important to check if you have other symptoms like chest pressure, shortness of breath, or swelling in the legs. To track it, try placing 2 fingers on your wrist or neck when you feel the irregular rhythm. Count the beats for 1 minute and write down what you felt. Share this with your doctor. They may recommend a simple heart monitor or an EKG to investigate further. Monitoring your heart's rhythm before it causes real problems can make all the difference. These early signs may seem small on their own, but when we look at them together, they tell a much bigger story. Let me leave you with this. We have just covered 8 subtle signs that your heart may be under stress. Fatigue that will not go away. Breathlessness during simple tasks. Sleep that gets interrupted by breathing problems. Pressure in the chest. Pain in the jaw, neck, or back. Cold sweats without a clear reason. digestive discomfort that does not respond to anticides, and heart rhythms that feel off or irregular. Each of these symptoms might seem minor on its own, but if they are happening more often or showing up together, they should not be ignored. If any of this sounds familiar, take it seriously. Talk to your doctor. It does not mean something bad is already happening. It means you have a chance to stop it before it does. Thank you for watching. If this helped you or made you think about your health differently, please like the video and subscribe to this channel. And before you go, leave a comment and tell me which country you are watching from. Your voice matters here. Take care of yourself and take care of your heart. See you in the next video soon.